We've been hearing a lot about liquid nose jobs lately. In fact, Sonia Morgan from Real Housewives confessed to having her nose injected with fillers to create a more refined look. So what is a liquid nose job, and why is everyone talking about it? Well, joining us via Zoom is Dr. Kevin Kalwerisky. He's a cosmetic surgeon from the Consultant Clinic. We also have Ciara with us, who will be getting the liquid nose job procedure performed on her today. Welcome, Dr. Kevin. Thanks for being here.
Good morning, everyone.
All right, so let's start off. What is a liquid nose job? Sounds interesting.
The liquid nose job or liquid rhinoplasty is when we use a gel called a hyaluronic acid, and it's injected into the nasal structures using either a blunt cannula, sometimes a sharp needle. And with these techniques, we can make the nose look more delicate, a little bit straighter, more refined. We can make a large nose look smaller. It can also be used to tweak little imperfections following a surgical rhinoplasty once the patient's healed.
Wow. So I'm looking at some of this picture here. Wow, that you wouldn't believe that this is something that's being done, and this too, without it being a full kind of invasive rhinoplasty. So, wow, look at that. So how long does it take typically?
Procedure itself usually takes about 15 to 20 minutes.
And do you need anesthesia, or is it just topical? What do you do anesthetic?
So it can be done with no anesthetic, but I'm a very kind and caring doctor, so we try and minimize the pain with a little local anesthetic.
And lastly, are the results apparent right away, or do you have to wait?
Typically, the results are seen immediately.
Okay, good. So what is the plan for Ciara today?
And the first thing that we want to try and do is reduce the appearance of this dorsal hump right there. So she has a high point and a low point. And we can sort of simulate what putting a little filler in will do for her. We're going to try and give her a little more tip definition. And we're going to try and open up the nasolabial angle to give the nose a little more refined appearance to it.
So I heard, Dr. Kevin, I heard your take. So, Ciara, can you tell us what exactly bothers you about your nose?
I just really like the look of a straight nose. I always have, and I've always had this little bump. Okay.
Well, you're in the right hands, it seems. So, Dr. Kevin, hey, listen, let's get started because we're going to bring you guys back on at the end of the show to see the results. So go ahead and let's see you get to work.
So the first thing I'm going to do is administer a dental block, which is a little bit of anesthesia underneath the lip. It really makes the whole procedure much more comfortable and guarantees that the patients will have an easy experience.
I know people at home are squirming a little bit. They see such a big needle, but really it doesn't hurt. Don't let the size or the length of the needle fool you into whether or not it's painful.
It's actually a small pediatric gauge needle.
All right, Dr. Kevin, this is great. Loving it. Ciara, we are excited to see how this goes.